I'll be your nurse today. My name is Sage. This is Mary. She's going to be taking your vitals. We have a few questions for you.
Sounds good.
How are you today?
Oh, not so good.
Not so good. Are you having any pain?
Lots of sharp pain right down here.
Can you rate your pain for me?
Oh, at least a 9.
At least a 9. That's a lot.
Oh, yeah, I'm not feeling too good.
Are you having any nausea and vomiting?
Oh, 2 weeks ago I came in because it was just mild, but now it's just gotten so much worse.
Oh, goodness. Can you tell me how many times that you vomit during your day?
Probably, I can't keep anything down, so at least 4 or 5 times a day.
Gotcha. And was this an unwanted pregnancy, or was this planned?
Oh, well, so I had some antibiotics I was on, and the doctor thinks that that's how I got pregnant, because I was on birth control, but
Yes.
it just didn't work apparently.
That'll cancel it out, yeah. Have you been on bed rest lately?
Oh, I was on bed rest in my last pregnancy, but not this one quite yet.
How many pregnancies have you had?
Just had one other one.
Just one other, okay. Do you know your weight today?
145-ish.
145.
So I've lost some.
You've lost some? How much have you
Yes.
lost?
Oh, about 3 pounds.
Over what period of time?
The last 2 weeks.
Last 2 weeks. Did you experience this during your first pregnancy?
Not as bad, no.
Not bad.
It was pretty mild.
So, are you having contractions right now, do you think?
Just little ones, but I don't know. It just makes me nervous.
How often are they?
Oh, they were about 20 minutes apart. Now they're about 10.
Okay. How strong are they? You said you have pain of 9 out of 10 right now?
Yeah, the contractions are probably like a 7 or an 8.
Okay. Where do you feel your contractions at?
Right down here, there's sharp, sharp pain.
Oh my goodness, that's not good. Did the contractions change with your movement?
Oh, not so much, no.
Well, I will have the doctor check on your medications,
Okay,
and then we'll work on getting you some.
sounds good.
I'm just gonna feel your stomach, okay?
Okay.
You tell me if you're feeling anything. Lift up your, down here. Feel
Oh,
anything?
just right down there. Oh,
Okay. Be careful.
oh goodness.
And then I palpate the cervix and check for bleeding. Okay, we'll be back, okay?
Sounds
Is there
good.
anything I can get you?
Oh, I'm good for now.
Okay.
All right, I have the meds that the doctor prescribed for you. Can you tell me your name and date of birth?
Kaylee Zen 0304 of 1990.
Perfect. And then, do you have any allergies?
Sulfa.
Okay, these meds won't interfere with your sulfa allergy.
Okay.
So I have thiamine, and then I have metoclopramide. And the thiamine is for you and your baby, and it converts the carbohydrates that your body has into energy, helps your nervous system, muscles, and heart, and it's essential for your baby's development.
So this isn't gonna hurt my baby, is it?
No.
Okay.
And then the metoclopramide is a drug frequently used for nausea and vomiting in pregnancy.
Is that okay for her to take?
Yes, there isn't as much research on that, but there's many pregnant women that take it and find significant results for it. And then, since you're dehydrated, we're gonna start some IV fluids on you too.
Oh, thank God. Oh.
Hello, my name is Dr. G. I have some information about what we diagnosed you with.
Finally, it's been taking a long time.
I talked with a couple other doctors, and we think you have hyperemesis gravidum.
Is that okay?
What is that?
It's common in pregnancies. So basically that means you are having your excessive nausea, vomiting, which leads to your dehydration and weight loss, and your electrolyte imbalances, which were all taken care of with the meds that you were given
Oh my
earlier.
God.
You were given meds earlier, correct?
Yep, I was. One of the nurses came in and gave me my meds.
Perfect. Did she educate you on them?
Yep, she told us that what one was it, Mom? The thiamine and the
metoclopramide.
metoclopramide. That's what it was. Yeah.
Yep. They're safe for your baby and they'll help. So we'll prescribe those to you after you leave too. But we want to keep you here for a little bit to get your fluids back up and your electrolytes kind of balanced out again. So we did rule out appendicitis, cholelithiasis, and a UTI with
Oh, thank God.
your tests earlier. Do you have any questions for me?
Is my baby okay?
Right now, yes, we have this heart monitor or this pregnancy monitor on you, and it's monitoring your baby and your contractions and your baby's heart rate and all that kind of stuff. So we're keeping very close eye on him.
Is she gonna be okay?
Yes. We just need to balance out her electrolytes and stuff, and she should be feeling better.
Awesome.
Relieve this nausea and vomiting.
Oh, thank goodness.
The contractions you're having are called Braxton Hicks contractions.
Okay.
They're kind of that sharp feeling down there, aren't
Yeah.
they? Yep. So that's just kind of the scientific name for them. It's common again. So
Okay. So are they real contractions? Am I gonna have my baby?
no, not. You'll have your baby at normal times. So
Thank
it's
goodness.
just kind of along with your hyperemesis gravidum that you're
Okay.
having these contractions. So
Okay.
Will
Sounds
any of
good.
this go away?
it should with the proper care and everything. I'll send your nurse in to educate you about the care that you should be taking at home and
Okay.
the meds that you should be taking at home and all that kind of stuff.
Okay.
Do you have any questions for me?
I think that was it.
Alright, we figured out what's wrong with you. I'm gonna send you home with a little bit of education, okay?
Alrighty.
So, to help your contractions, it'll help if you change position and activity level. So,
Okay.
if you're feeling some sharp pain while you're up moving around, just try to rest and vice versa, okay?
Okay.
And then we really want you to relax, so have your husband, help you with a bath, give you a
Oh
massage.
yes, I'm sure I can make him do that.
Maybe some music, take a nap, any of that. And then we want you to notify the doctor if you have any vaginal discharge, bleeding, like you're leaking fluid,
Okay.
or if you have strong contractions every 5 minutes, like contractions that you're not able to walk through.
Okay.
And lastly, if there's any change in the movement of your baby, if there's less than 10 for every 2 hours, okay?
Okay.
And then we want you to keep your stress levels down as much as you can. That'll also help.
I can sure try to do that.
Okay. Well, is there anything else? Any questions that you have for us? still?
I don't think so. Do you have any questions, Mom?
I don't think so.
Great. Okay.
Thank you guys so
Thank you.
much.
Of course.